Thank you so much for having me this afternoon to talk on this very important topic. I will be talking about enhancing communication skills and relationships through communication skills. And in hearing the two talks that just came before me, I can't help but think how relevant everything that's been said is to what I'm going to speak to, which is this concept of dialectics. And if you're thinking it might be a Greek word, you would be correct. But before I jump into that, if I think about enhancing communication skills and relationships as not just being relevant to the work that we do through healthcare work and pastoral care, you may have heard through news or through the work that you're doing that we're in a loneliness epidemic. They say that loneliness and feeling disconnected has significant implications for physical healthcare outcomes as well as psychological well-being and psychological health. And these skills and these concepts that we're talking about and that have been spoken about prior to me are relevant not only to the work that we do, but also to the day-to-day interactions we have with everyone that we come across in our life, the concepts of compassion and care and patience, understanding, acceptance. And if we think about it in the context of our work as well, as has been said, the therapeutic relationship is so important. And from a clinical psychology framework, we actually know that the biggest predictor of therapy outcomes, so when I see a patient, the biggest predictor of therapy outcomes is the relationship that I have with the client. And that is above and beyond the particular type of therapy that I may be doing, the particular presentation of the client. It's actually the therapeutic rapport and relationship that has some of the biggest outcomes and is one of the biggest predictors of change. So those micro-counselling skills that are so important to therapy and to our relationship with others are really crucial in terms of being able to help those that we work with. So what are dialectics? Usually, when I talk about dialectics, most people have some idea that dialect, okay, it's got something to do with language. We understand that, we know the word dialect, so sort of different languages. But dialectic has its origin in ancient Greek philosophy and language. So at its core, the term dialectic comes from the Greek word dialektiki, which is derived from the verb. Someone's going to have to help me with this one. Dialegeste. Thank you. Your Greek is much better than mine. So meaning to converse or to have discourse. So in its earliest kind of usage of the word dialectic, we're really talking about this ability to have a conversation with someone other, but in a way where we can have different perspectives and different views and have sort of meaningful discussion, and the philosophers refer to it as argument, meaningful argument. And in terms of the Greek philosophers, Socrates, Plato, Aristotle, they were very influential in developing this concept and this method of dialectics. So we expand dialectic from being just a way of talking to a method by which we converse with other people. So Socrates famously had his Socratic method of using sort of questions to question and answers to simulate critical thinking. Aristotle developed this further. He developed a bit of a handbook and a manual for how we actually engage meaningfully in argument or debate. And when I was listening to the previous talk, I couldn't help but think again as to, the patients who come and see us or the people that we work with who are not always going to agree with what we have to suggest, and we are not always going to agree with what they are sort of presenting to us as well. And so the ability to have respectful and meaningful discourse that allows for both perspectives to have space in the therapeutic relationship is so crucial and really is a little bit of an art form. So we look to kind of dialectics as a way to consider that. Now dialectics through many methods through philosophy has changed. And it's been developed and reinterpreted, but now it's commonly seen as a way of analysing contradictions or changes in thought as a technique for kind of debate and discourse. So dialectics allows us to consider opposing views. I simply put it as dialectics is the ability to kind of see that two things that might seem opposite can both be true at the same time. And so I often have this kind of picture of a balance in mind when I'm talking about dialectics to people, and referring to it's this and it's that, not this but that, but it's this and it's that. So the example that I use most commonly that I think most people can relate to in some way is the dialectic of, on the one hand, I can be in a room full of people, and on the other hand, I can feel very alone. And those two things seem to be opposite, but they can both be true at the same time. Another example is the notion that on the one hand, I can be and feel very capable, and on the other hand, I can need support from other people. And they seem like opposites, but both can be true at the same time. So dialectics enables us to hold opposites both true at the same time, which is so important when we're having conversations with other people. I can disagree with you, and I can understand your perspective as well, and I can give space for both. So dialectics, I won't go too much into this, but dialectics has sort of been the foundation for a particular type of therapy called dialectical behaviour therapy, which is an evidence-based therapy and helps those who may have very black and white ways of thinking, often due to experiences in life and traumas in life. It enables them to kind of hold a dialectical stance, to be able to see two opposing things as both true at the same time. And the core dialectic in DBT is that of acceptance and change. So in any given situation, there are elements of that situation and circumstance that are out of my control. I cannot do anything about it to change it, and so I accept it for what it is. And there are elements over which I may have some agency, I may have some autonomy to make changes for myself, and for those elements I can do something about that. And the both are always true at any one time. And if we think about this concept of acceptance and change, we may be reminded of the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And often when we're talking with the clients that we're working with, it really is that wisdom to know the difference that comes about as being very important. We may often find that people sometimes get stuck in wanting to change things that they fundamentally cannot, that are out of their control, that they have no option to do other than accept, or trying to change things in a way which are ultimately quite ineffective because they haven't accepted the reality for what it is, as painful as that may be. One of the wonderful things I like about this sort of dialectical approach compared to some of the more traditional types of psychological therapies is that traditional therapy was much more focused on change, on helping people change the way they thought, change the behaviours they did, change their emotions, whereas this kind of third wave movement of therapy that we work from now still helps people change in ways that are relevant and effective for them, but it has the added focus of acceptance. Accepting the experience for what it is, accepting reality for what it is. And that's not to say that acceptance means approval. I don't need, if I accept something, I don't approve of it or think it's okay that it's happened or agree with it. It's simply me saying, it is what it is, and I cannot do anything other than to accept it for what it is. And so these are the kind of the features in which we can often see clients getting stuck. We also know that sometimes when clients get stuck in a state of non-acceptance, there is an additional layer of suffering that is added to an already painful situation. Life has pain, and that is inevitable. And yet if we get stuck in non-acceptance, we add an additional layer of suffering. So what do dialectics have to do with communication and relationships? Well, the dialectics can help enhance relationships by balancing opposing needs. It recognises that in any relationship, we may have contradictory needs and requests, such as the need for both autonomy and connection. So being able to understand this tension helps people navigate them more easily and more effectively. It helps us avoid getting stuck in kind of black and white ways of thinking, which we can all do very easily at times. But dialectical thinking encourages seeing multiple perspectives rather than absolutes when we're engaging with someone else. It's this idea of using and instead of but to acknowledge multiple truths, and being able to validate someone else through that notion of acceptance as well, while expressing our own perspective. Dialectics help promote flexibility, which is crucial for healthy relationships, and also helps us foster empathy by being able to consider other perspectives and increasing understanding in relationships. So in terms of the work that we do with individuals, and particularly when I see clients in the therapy room, one of the things I often think of is this kind of imaginary line between myself and the client sitting in front of me. And I think about this sort of spectrum of acceptance and change. And I try to figure out where the client is sitting at any one point in time. Are they very oriented towards wanting to change their situation? Are they very focused on making changes? How do I fix this? How do I change? How do I stop feeling this way? How do I improve my situation? Or are they potentially on the other end of the spectrum where they accept what is and they're in a state of, well, this is what it is. What can I do about it? This is the reality of my situation. And sometimes their ability to sort of oscillate between the two. And so I think about where they're positioned, and then I think about where I'm positioned. I don't know if anyone's ever had this experience of someone who is in a state of acceptance, but not able to make some effective changes for themselves. It can be a very sort of helpless and stuck state. And so I might notice my desire to want to jump in and give them lots of suggestions as to what they can do to try and help the situation for themselves. But if the person is not ready to hear that, it's probably going to be quite ineffective. Well, they might give me 5 reasons as to why my suggestions aren't that good anyway. And so it's my job to figure out where the client is oriented, and if I need to go and sit with them in that space of acceptance first, before then being able to help them also move to the change-oriented side so that we can work together to effectively come up with ideas as to how they can change their situation. So when we think about this kind of dialectical stance in our work, the therapist or the clinician needs to balance accepting the client as they are, while also encouraging them to make changes for themselves that are going to be useful and effective. I often use the word effective because we can try and do so many things to change circumstances, situations, how we're feeling, but they're not necessarily effective. So this creates this kind of dialectical stance for both the client and the therapist. And we use both acceptance-based strategies like our validation, like being able to provide the empathy, the rapport, the validation, the acknowledgement for someone's emotions and situations, while also balancing that with change-oriented techniques like assisting with cognitive modification or helping them build skills that are going to help improve their situation. And so I thought this would be the most relevant thing that I could share with you today, because it's not necessarily a hard, tangible skill, but it's a way of being with people, and it's a way of thinking in terms of the relationship. And again, I think of this kind of acceptance and change spectrum or balance between myself and a person who's in front of me, particularly when I am trying to help them. So a way of being able to kind of sit with someone to balance these very two kind of contradictory but very important needs of both acceptance and change. And so a lot of the work that we do from a kind of dialectical behaviour therapy framework is based constantly on helping people build skills within themselves to be able to be both accepting to their situation but also themselves, and also build the skills to help them to be able to change. So that was what I will leave with you with. Thank you so much for listening.